Yo, it's about to go down. I said, yo, it's about to go down.
What's going on? What's going on? Welcome to another broadcast of the Urban Health Nurse Educator. I am Steve Belcher. It's good to be back on air and talk health. So tonight, well, first, before I start the topic, 3 problems to avoid to keep your AV Fistula graft working well. If you're watching on YouTube, I want you to hit the subscribe button and the like button if you like what we're doing. If you're on Facebook and you're watching, go to the Facebook page, the Urban Health Nurse Educator, and like us on Facebook. Now, if you're a kidney warrior and you have a AV fistula or graft in your arm, I want to tell you 3 problems that you want to avoid to keep your AV fistula or graft working. Now, there's 3 problems, 3 that you want to avoid to keep your access working well and not have to take those unnecessary trips to the access center or to your surgeon's office. The first problem you want to avoid, infection. That's the biggest. Because if you get an infection and if it gets into your bloodstream, you can have a bloodstream infection and you can feel like total crap. Now, to avoid that infection, to avoid that problem, you want to, 1, keep your access clean at all times. Be sure your access is washed with an antibacterial soap and iodine or alcohol preps before it is used for dialysis. So when you go to dialysis and before you sit in the chair, after you get your weight or before you get your weight, you want to wash your access at the sink. Most dialysis units have a sink for patients to wash their arms at the sink. You want to do that first. Then, when you go to your seat, you have the technician or nurse clean your arm again with iodine or alcohol, and put a 2x2 over the site after they put the needle in. Don't just let them put the tape over the needle site with no 2x2 because you don't know where that tape been. That tape could have been in their pocket, on the floor, on the counter, and that tape has adhesive in it and it tracks dust and dirt. And number 3, what you want to do, pay attention and be mindful. Tell the nurse, your surgeon, the doctor, or the tech if you have on your access any problems with warmth, if it's warm, really warm to touch, redness, pus, or you experience any fever. The next problem number 2 you want to avoid is blockage. Yes, blockage of your access. Now, what you want to do each morning for yourself, or if you have a loved one that's on dialysis, make sure that they feel the thrill. That's the vibration that you're feeling on the arm. Let me see. I don't have the, Wait a minute. Hold tight, warriors. I want to show you. Give me 1 second, guys. I'm looking at a different screen. Let me see if I'm getting the picture that I want. Okay, yes. Okay, so let me show you a picture of what I'm talking about. Bear with me, guys. So, all right, you want to feel the thrill. Feel the arm right here where the access is, and make sure you feel a vibration, right? And then listen for what's called the bruit or the buzzing with the stethoscope. Or you can put your arm up to your ear with your access, like what you see here. Place that part up to your ear, and you can listen for the bruit or the buzzing. And also feel for the thrill each morning and night, okay, when you wake up and before you go to bed. Number 2, to help prevent from blockage, let your dialysis team surgeon know if the thrill, which is the vibration, or the bruit, which is the buzzing, changes. If you feel a change in the consistency or if it's stopped, make sure you let the dialysis team know right away, because that can make a difference between saving or losing your access. Okay. Number 3, to help you prevent or to avoid blockage, let your dialysis team or surgeon know if your hand is cold, blue, numb, painful, or hard to move. Okay. Now, the third problem you want to avoid is injury to the access. Injury to the access. Now, in order to avoid injury to your access, learn to rotate. I repeat, learn to rotate needle site on your access. You gotta rotate that site 2 finger width apart from the last needle insertion. Number 2, do not carry heavy weights across the access. Try not to lift anything heavy with your access arm. Number 3, avoid pressure on the access. And what I mean by that, avoid having any caregivers, professional as well, take a blood pressure in your arm that has an access in it. Also, try to avoid sleeping on your access arm, okay? Because if you sleep on your access arm, you can compress the access, preventing or constricting nerves constricting blood flow to go through the access. I saw one of my co-workers I used to work with. Let me give her a shout out while she's still on. Oh no, that's not her. She got the same last name. Wow. But hello to Tatiana Tagrio. Thank you for joining. I thought you was one of my co-workers I used to work with, but God bless you. And thank you for joining, Tatiana. Try to avoid sleeping on your arm with the access, because you can, the pressure compressing down on the access can kind of prevent blood from flowing through your access, especially if you have small veins. So you want to be careful with that. Also, avoid tight clothing on this arm as well. You don't want anything that got a band on it that can constrict your arm. You know, you want to avoid trying to pull your sleeves up, because that can constrict the blood flow. And also, do not, I repeat, if you have to go to the emergency room or you go to a patient first or one of these emergency access places, do not let no one, I repeat, no one draw blood from your access site. Only a dialysis nurse or technician, when they put those needles in, can do that. Don't let anyone else, I don't care what they tell you, do not let any other practitioner stick this arm. Now, I went through the 3 problems to avoid: infection, blockage, and injury to the access. Now, let's discuss, all right, let's discuss, let me clear this picture. So let's discuss what questions you should ask for each problem if you run into it, or just to prevent and avoid that situation. So the problem, if the problem is infection, you worried about it, you want to avoid it, these are the questions you need to keep in mind and pose to the caretaker, the nurse, or the technician who's putting you on, or even to yourself. How should I clean my access? If you're new to dialysis, you just got your access 6 weeks ago, a month ago, 3 weeks ago, did anyone tell you how to clean your access? 2, do I need to cover my access in the bathtub or shower? Some warriors got a PD catheter, and you may not can't sit in the tub because of the dirty bath water and the germs that may sit still. Number 3, you should be asking, can you swim in a pool or a lake? I mean, if you have a graft or a fistula, yes, you can. But with the PD catheter, or you have a catheter in your neck, these are the things you need to ask and you can't do. The next question, who should I call if I have an access problem? Let me tell you something before I move on to the second problem of the questions that you should be asking. This last question, who should I call if I have an access problem? Let's say if you have dialysis on a Friday, your access is working, and if you get your full treatment, right, whatever, your 3 hours, 3.5 or 4, you get your full treatment, and then Saturday you wake up, right, and you do your access check like you're supposed to do every morning, right? You feel for the thrill, and you listen to the bruit if you don't have a stethoscope. If you don't feel anything or hear anything, if you're not experiencing any shortness of breath or any other problems, I don't recommend going to the emergency room, because when you go to the emergency room, what's going to happen, they're going to check your labs and they're going to see that they're out of whack, of course, because you're a renal patient. But they're going to admit you, and something that could have been done in several hours, now gets turned into 2 to 3 days in the hospital, and everybody and their mama come into your room to do a consult. Everybody from GI to endocrinologist, heart doctor, cardiologist, everybody in Broomhilda, right? And all you wanted was you got your treatment the day before now, and you felt good. Only thing, your access not working. Now you laying in the hospital bed, and you like, how did I get here? So to avoid, only go to the hospital in that situation. This is just my suggestions. And hold on, before I say something, let me just put this overlay up right quick. Let me remove the banner, because I mean, I don't want nobody coming back and suing me or getting it twisted, right? So let me just say, education disclaimer: the information broadcasted on this show, this is not Urban Health Outreach Media, but we're an extended part of it, is provided for educational and informational purposes only, and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Now, with that being said, look, if you had treatment on Friday, you feel your access Saturday, you do the checks and it's not working, if you're not experiencing any shortness of breath, any heart problems, or any adverse symptoms, it's no need to go to the emergency room. What you do, you wait till Monday like you would normally do, right? You call the unit first thing in the morning. Most units, someone is there at 5:30 in the morning. If you're Monday, Wednesday, Friday, or your TTS, and you come home after your shift on Saturday and you feel this happen on Sunday, either or, right? Call a unit first thing in the morning. Ask for the charge nurse and tell the charge nurse, look, my access is not working. I can't feel it. What they're going to do is reach out to the access center. They're going to fill out a scheduling form. They're going to call your doctor, the nephrologist, or they're going to use the access center. You may not have been there before. This may be your first time. And so what happens if this is or was your first time, what normally happens, the nurse fills out a scheduling sheet, has all your information on it, your insurance information, date of birth, what the problem is, clotted access, what arm, is it upper or lower? Are you allergic to the contrast dye? Are you diabetic? What else? Do you have your own transportation, or do you need transportation? Some places send their own transportation to pick you up and bring you back home. But it's a scheduling form, so we got to fill that out, and then we got to send a list of all your medicines, and then we got to send a copy of your insurance card, your Medicare card, or if you got Medicaid, private insurance, whatever, and a history and physical, right? And I think maybe a discharge summary. Some places are different, but we're sending this information over, and this is your first time. They're registering you. And so you go there and they do what's called a fistulagram. And what that is they pretty much like a declot, or they pulling out the clots, right? And they put you under maybe a twilight, not no big heavy general anesthesia. Some places may put you out just a little, but some places give, what they call twilight, give you something called Versed. And so once that happens, they give you a light lunch at the access center because, you can't eat 4 hours before you go to the access center. So once that's done, you're sitting there, you in recovery pretty much. You're eating on something, graham crackers, some juice, something like that, right? And you're waiting for the transportation to pretty much either come back to take you home or you're going to dialysis. So that's how it works in a nutshell for people who have not experienced an AV blockage or had to go to the access center. This is how most places do it. Now, if you find yourself in the hospital, it runs a different course, okay? You go to IV interventional radiology or your surgeon does it. They may have to do revision depending on what's causing the blockage. Now, with infection as well, you need to call the surgeon and the dialysis team if you notice pus, redness, warmth, or anything coming from your access or opening, whatever. Call immediately. Now let's move on to blockage. That's the second problem you want to avoid is a blockage. And what I just talked about, your arm may clot or not work. Now, can my doctor or nurse tell that my access is not working? Of course. Now, let me tell you, some warriors go to dialysis and they're supposed to do an access check before they put the needles in to see if it's working. I've known many patients who have been stuck and then found out that they were clotted when the technician could have checked the arm before they stuck the needle and prevented that pain. Another question you need to ask, how would they know if your access is clotted? By this. This what you need to have. This is called a stethoscope, and I'm not trying to insult anyone's intelligence, but this is what you need to have right here to listen, or you can listen with your ear. But what we do is we put this in, right? We're listening, we're checking to see, can I hear it? I'm feeling for it, listening, making an assessment. That's how we do it, right? And you can do that too. You can go to a drugstore, a medical supply store, and buy your own stethoscope. A nurse uniform store, get your own. Take charge of your health. That's what the urban health nurse educator suggests. Take charge of your health. And if you like what we're talking about, again, subscribe to the YouTube channel, the Urban Health Nurse Educator. And if you're watching on Facebook, go to the page, the Urban Health Nurse Educator, and like and follow our page for up-to-date information. Up-to-date health information. This is going to be on a consistent basis. On Mondays and Fridays, you're going to get up-to-date, live, fresh broadcast. Now, the third question you want to ask yourself about this blockage. If my access is blocked, can it be fixed? When and how? That's the questions you want to ask if you want to avoid the blockage, or if that blockage happens, you want to know, can it be fixed and how? You don't want to be left in the dark. Because I've seen some warriors fall through the cracks and they couldn't get to the doctor in time, and they end up having to get a whole new access. You ask, there's warriors who have multiple accesses, 3, 4, 5 accesses. One on this, one right here, one right here, one right here, one right here. I've seen warriors one in the chest, and now it's in the leg. So please be mindful. The last problem you want to avoid is injury to your access. The questions you want to ask yourself is, what is the needle rotation pattern for your access? That's right. You definitely got to rotate the needles so you don't keep sticking in the same place to get aneurysms or to wear out your graft or fistula wear it out sooner than later. That happens a lot. Another question you want to ask: how much weight can I carry safely after surgery? Right? On your arm. The third question you want to ask yourself: can I wear a watch? Some warriors like to wear a watch, or have a purse over my access arm. Some warriors may want to wear a watch on that access arm. So you want to ask those questions. Last but not least, you want to ask yourself, how can I avoid sleeping on my access arm? You may need to prop it up on a pillow, right? Because if you lay on that arm, you can compress the access, which can prevent blood from flowing through and can cause it to stop. So as I end this broadcast, I'm doing another call to action. Like and subscribe to the Urban Health Nurse Educator YouTube page, right? And Facebook page. We need your support. We're going to be putting out more content to help warriors, not only kidney warriors, but people in general that need information about their health. All right. So with that being said, I want to thank everyone who watched this broadcast. No comments, so I can't acknowledge. I can't acknowledge on my Facebook Live. I'm sorry, my Facebook party. Kathy Mullins, thank you for watching. Tatiana Tagirov, thank you. Maxwell, my cousin, my long lost cousin. Maxwell, thank you. Darlene Cunningham, thank you. God bless you. Janice Little, God bless you. Eric Bush, Tatiana, Kathy, who else? Claudette, Christine Ellis, Gary Botenheimer, Claudette, Chef Jaffe, Big Tony Fisher. Get well, buddy. Get well, Big Tony. Got you in our thoughts and prayers. Anvir Singh, thank you guys for watching. Appreciate the love and support, and please share this again. Like and subscribe to our YouTube channel, the Urban Health Nurse Educator YouTube channel. We need your support. I'm giving a call to action. We will be consistent. I promise you. We will have more topics, not just talking about access blockage. We're going to be talking about everything under the sun: hypertension, sodium, what? I already talked about strokes, parathyroid, diabetes type 2, lupus, sickle cell. Everything that you can think of that affects the urban community and abroad. We're going to talk about it right here on the Urban Health Nurse Educator. So with that being said, thank you guys for watching. Thank you guys on YouTube for watching, Facebook. God bless you. Stay blessed and encouraged. Stay safe. And again, be mindful of your own health. Peace and love. God bless you. I'm out.
Y'all, it's about to go down. I said y'all, it's about to go down.